So we'll give folks 30 more seconds to join, and then I'm going to turn things over to you, Jessica. The first question that we ask all 9:30 callers is for you to tell us a little bit about you and how you came to be in your current role. And I know you have a lot of chapters to your story, so tell them, all of us, and then if you have slides, you can share your screen. And then we'll post any slides in our follow-up folder, and we're recording the call, so we'll add that to our YouTube channel as well.
Okay, thank you. I don't have slides to share, but I will
Okay.
put information in the chat, and then I'll follow up with you
Perfect.
with an email with all the information.
And we can add that to the follow-up. We can add the links. We have another follow-up folder with links.
Perfect. Thank you.
So as folks are joining, just yesterday we sent out an email in the start of the series to kind of get to know the new SFC. So hopefully you saw that. And then today we are formally announcing the fellowship program the Early Childhood Policy Pathways Fellowship that we've been kind of teasing here with information on the 9:30 call. So we'll put that link in chat so you can read about that. We know the Rennie Center new Early Childhood Fellowship launched last week, which we'll hear about at some point here on the 9:30 call. So lots of exciting things happening. So be sure to check your email. But now I'm so happy to introduce Jessica Acevedo, who has a lot going on. So I'm gonna let her tell you what's going on in her life, and we're excited to hear your update. So I'll turn things over to you.
Thank you so much, Amy. Good morning, friends. I'm so happy and excited to be here. I do not have any slides because I actually want to talk to you guys. So I'm really excited to be here. And I hope that we have really engaging morning. So my name is Jessica Acevedo. I am a doctoral candidate at the University of Massachusetts, focused on early childhood education. I'm also an owner and operator of a family childcare program in Cambridge for the last decade and a licensed realtor with deep roots in the Cambridge community, as well as an advocate for community-based change and sustainable support for early childhood programs. And the research project that I'm presenting to all of you today is titled Diverse Voices, Shared Visions, a Narrative Inquiry into the Sustainability of Family Childcare Programs and Public Housing Developments. So that's a very big title. So really what I want you guys to hear is that it's really focused on family childcare programs, but really the essence of the work is the stakeholders. So the stakeholders include public representatives, they include the parents, they include the providers, they include the housing agency representatives, and there's a really diverse scope that I look to focus on. So the research addresses, so I'm sorry, before I skip, so how did I get to this role? So I've always been a student. Before I'm a teacher, I'm actually a student. Before I'm a practitioner, I'm a student. I love learning. I love facilitating. I love having people learn something from me or taking an experience or activate or engage people. So I am truly a student at heart. And as a doctorate student, I have continued that. I actually started my doctorate studies in 2020 during COVID. So that's one of the times where I was able to connect with Amy and really start advocating. And I always say this during my doctorate interview, they're like, well, why would you want to start during COVID? I'm like, well, this is the most important time in research. This is the most important time for the field. This is, as a family child care provider, I definitely felt at times that I couldn't make change in policy, that I couldn't disrupt the things that were affecting not just me and my team and my families, but the broader community. And I know the work that I was doing, even independently, was super important. So I wanted to uplift that. I wanted to learn about the data. I wanted to learn about what they were telling us rather than just being talked to. So that's one of the reasons I don't have slides today, because I really do want to engage the stakeholders that we have here. And I know that Amy has built such a great network that I'm just here for the conversation. Sorry, I muted myself. I'm going to put in the chat. So I did make something because I am a teacher. So I know that people need writings to focus and understand. So I did make English, and then I translated to Spanish. So if you do want to share or speak Spanish, on the second page it is translated. So why this research is super important is because family childcare providers are underrepresented in early childhood research. So in general, there's just a lack of understanding of who they are, of what they do, of who they're supporting, of what their impact is. And usually what I do see when I am looking at the research, it's very deficit based. They're low income, they're women of color, just the generic data that we've been hearing. So I really want to uplift why is this important? So it's important because we're talking not just about low income families, we're talking about working families. We're talking, especially, and for me, I'm looking at urban communities and I'm focused on Cambridge and Lowell. And why I chose those two cities is because they have a comparable population size. So they have about 100,000 people and growing. We also need to increase the number of licensed providers. It's super important that we're not just engaging newcomers, but retaining the workforce through diverse models of operation. For example, and this is just a really small example, the city of Cambridge only has 17 family childcare providers, and 6 of which are operating in public housing, which surprising, not surprising, considering the cost of living in the city of Cambridge. And I can also, as a realtor, co-sign that, the costs in a 3-bedroom is going anywhere from 3,000 or more. And that might not include laundry, that might not include parking, that might not include a play space or a backyard. So just really thinking about what do these providers need in regards to space. And then at the heart of everything is always the community. So how are we building sustainable and economic spaces of growth that benefit everyone, even the people without children? Because I think sometimes we leave people out of the conversation because they don't have children or they might not be in an early childhood role. And just thinking about how do we foster neighborhoods and workforces of thriving communities. So I did put my project narrative in the chat again. So if you want to look at that, but I think what's also important is that we consider when family childcare programs fail, what happens? So there's a loss of affordable childcare programs, whether it's low-income families or working families again. There's a disruption in children's early childhood development and their learning. So children are being relocated to new classrooms. Sometimes parents aren't even putting them back in school because they can't afford it, which I hate to hear, right? Also, there's an economic hardship for the providers and for families. And that's not just providers, that's the staff. Those are the people that they pay. Just things that we really need to think more critically of is, when a child unenrolls or a child transitions, how does that impact the program? And also, there's a reduced ability for parents, and I emphasize parents, mothers and fathers, to work. And we know how that important that is for sustainability for our families. So we see a weakened communities of sustainability and overall trust, which is another consideration that we don't even really talk about, is that we need for parents and families to trust the work that we do. We need them to feel that the space is safe, that their children are safe, that they're safe to go in and out, and just thinking of all those things that we think of high quality and what that actually includes. My research questions highlight and focus on and are looking to focus on identifying sustainability for family childcare providers in public housing, and what does that look like? So is it more reasonable because of the cost? Is it the location? Is it the proximity to the families? And really just having them and the people within the groups that are facilitating or within the experience actually answer the questions of how that makes it sustainable for them and their families. I also want to do a comparison. So Cambridge and Lowell are different cities, but they are cities. So just where do we start? We look at what's happening and getting the perspectives of these FCC programs and what's effective to them. So effectiveness to me, to Amy, to all of you is different. Effectiveness for me, for my program, is that we're able to open at 8, close at 5. Children are safe, that they're learning, that they're outputting learning, but from an outsider or stakeholder, effectiveness could be having 5 programs or 10 programs, and it could not necessarily mean the same thing. So really understanding what effectiveness looks like. And then we really want to always, as Amy advocates and the strategies team advocates, is recommend policies. We want to improve long-term sustainability. It's not just about right now. It's about 5, 10, 15, 20, 50 years from now when the work that we're doing right now is still in full effect. So the way that I want to approach that is by actually interviewing 22 stakeholders. So I'm looking to interview family child care providers in Cambridge and Lowell, parents and families and guardians, because we know it's not just parents. We don't talk about how many grandparents are taking care of these children. So I know that it's not just parents that I may talk to that are caring for young children. The public agency representatives, which includes the Department of Early Education, the housing authorities, and also elected officials or local officials. So these are so many people, but it's so important to really have these voices in depth. The way that I look to do that is to do semi-structured interviews. And what that means is that I am going to come with, my questions prepared, but then as they tell me about their experiences, I'm able to ask more questions. I'm able to ask more in-depth questions. I'm able to ask for more recommendations and really hear to analyze the following, which is housing sustainability, provider compensation, quality of care, and agency support. So sometimes when we have one voice, we're actually leaving all the other voices out. So really thinking about who do we need to hear from, which is everybody, which is really hard. But I think this is one way of doing it. And then again, this is just an overview of my project. So what I'm focused on again is family and child care providers operating in public housing, specifically in Cambridge and Lowell. And the significance of this is because the diverse demographics. There's also active FCC ecosystems within these cities, and then they also have varied housing policies, but they all have a Plan E. So they do have a city council structure, which is really important to talk about and also inform people of how local government affects budgeting and policy and things of that sort, because then that's a whole other thing. So again, I'm here to have a high level conversation with all of you because I know you guys are all critical thinkers. So what I actually would love to do is have you guys engage, whether it's through the chat, whether you guys want to email me, whether you want to email Amy, and really just think about not just childcare, but housing. Think about public policy. Think about these levels of conversation that we are craving to have in these spaces. So at the core of this study is not only about childcare, housing, or public policy, it's about the intersection of three. It's about what happens when care work is expected to thrive within systems that are often not designed to support it. We're asking providers, many of whom are women of color, undocumented document immigrants, and heads of households to operate small businesses in settings that are often structurally unstable, underfunded, and overregulated with little coordination between housing and early education systems. So the first question I have to present to all of you is how do we expect sustainability from systems that aren't integrated?
Jessica, thank you so much. I'm gonna go to the chat while people are thinking about your question. And so
For
Kate
sure.
Warren Barnes shares, cheers to you starting your study, Jessica. This is such a big milestone. I would love to share a flyer for your research study on LinkedIn. Kira Wilkie says this is so important. Children's Investment Fund does work on housing and EEC, and we'd love to connect. I'll reach out. We're also working with the task force on this, and I know you've talked to them, which is great. Donna Danette says disruptions and attachment, which is when you were talking about family child care programs closing. Paula shares Echo Latino is a Latino family child care community statewide. We shared today's calls, and there are 2 educators from Cambridge. We hope they can help your study. Let's connect. Melinda Weber says, hey, Jessica, thanks for this important work. We do lots of work in the family child care space, especially understanding the business model and have great partners in Lowell. I'll reach out. So Jessica, while I'm reading the chat, if you could add your email to the chat, because other people have private messaged me looking for your chat, your email.
Oh, I love that for us.
And
Yes,
then Michelle Mendez says that please repeat the question. So um
of
repeat the
course.
question, Jessica, and then add your
Yes.
Andrea Parker has her hand up, but why don't you go first, Jess, and then we'll go to Andrea.
So the question I presented, which wasn't really a question to be responded to right now. And if you want to answer it in the question, and whoever has their hand up, if you want to actually answer the question, was how do we expect sustainability from systems that aren't integrated? And I'm sorry, I can't see hand raised because I have my screen with my notes.
Right. So, Andrea Parker, why don't you go ahead and Jess, I can put your email in chat because I have your email, so you can pay
Perfect. And
attention.
I do have that in my notes to put it at the end so it doesn't get lost. So don't worry
Okay,
about that.
great.
Yeah.
Go ahead, Andrea.
Thank you, Jessica, and congratulations on your work so far. I know how challenging it can be to find participants for research studies and such. So I definitely hear your question, and to be honest, I'm pretty unfamiliar with FCCs. In fact, one of my questions for you would be like, how do families find out about them? Like I have a colleague who's looking for one, and I don't even know where to tell her to, to find the bank of FCCs because she's trying to find a nanny or somebody to help her in her home, and I'm like, maybe consider an FCC, but I don't know where to tell her to start looking. And then the other, yeah, and thinking about your question, as I said, I'm unfamiliar with FCCs, but this does remind me of work that I used to do in the space of child welfare and children and youth living in or experiencing state custody, whether that's in centers or residential care, foster care, et cetera, and how the educational advocates that I was working with, this was their main complaint, that the systems aren't integrated, that you have the system, DCF, Department of Children and Families, you have the biological parents or caregivers, you have the foster parent or prospective adoptive parent, you have the educational advocate, if the child is eligible. Then we have all of the agencies, right? Aside from DCF, there's the residential or the home that this child is living in. There's um, all their health providers, all their specialists. And I mentioned this because I don't have a good answer to your question. Obviously, this is what you're researching, but it's not, it just reminds me of this situation. And I think we can and should expect integration. And when I felt like we were getting close to that, we were bringing folks together in conferences, in lunch and learns, moments where we could get brave members from these agencies to come in and really kind of, I want to say, like face each other and talk and think about.
Andrea, I'm gonna ask you just to wrap up because we have other comments in the
Oh,
chat.
sure. Yeah.
Sure.
So we had great participation from the Commission on LGBTQ, the Office of Child Advocate, DCF itself, social workers, and et cetera. So I will leave it there. No answer to your question, but just thinking about how this is an issue across different agencies and systems. Thanks, Amy.
Thank you,
Thanks,
Andrea.
Andrea.
So just to kind of give you an answer to your question, so one way that our parents and our families have been finding us is referrals. So direct referrals have been the best way. The Department of Early Education does have a search for families that they're able to go by category if they want a center-based, if they want a family childcare. So there is multifaceted ways of parents finding this information, but I don't think this is information that parents look for until they need it, right? So there's a certain time that parents are looking for recommendations or they're looking for childcare. So that's either when women are pregnant or when they're transitioning back to work, and that's both parents, not necessarily just mom. So that's one way, and then also for your friend that's looking, usually you have to kind of start in the community and start kind of where you are. But also sometimes workplaces will have childcare options. So it's really based on what makes the most sense to the budget and to the family and the location. But I'd love to connect with you, Andrea. And then
I added your email to the chat.
and then I do have two more questions and then I'm done. So
Great.
the second question I have is considering housing sustainability and affordability, how does that affect your personal and professional life? Again, this is a safe space. You don't have to share if you want to email me, if you want to say it in the chat, but I'd love to hear from you guys. What I want to share from you guys is that as an adult, as a professional, things have changed for me. Like when I was in undergrad, I lived in a room, I rented a room, then I moved back with my parents, then I lived independently, then I lived in my program. So I have had so many changes in my own housing, and it directly affects my ability to thrive and to be able to go to school or to work and things of that sort. So I just wanted to hear about how housing, and maybe this doesn't, I don't know if anybody wants to share.
I don't see, the chat is full of other things as well.
Okay.
I don't see any answers at this moment.
It's okay.
Jessica,
I can come back.
Well, there's a
I can
sharing the
warm
mic.
up
You
the
can always come back.
question.
So the question
I
is
do have
about
another
Go ahead.
question. So think about your community then. Maybe this is not a question that you feel comfortable right now, but what about the impact that housing has on your community? So how does it affect Marissa? Sorry.
Hi, Jessica.
Good
I actually
morning.
think your last question kind of connects to the comment I put in the chat too, so I just figured I'd read it aloud also. But um, I know that we've heard a lot from family childcare, how housing obviously especially affects family childcare because they're operating their business inside their home, as well as obviously living there. So it's sort of that double impact that not all of us experience, where you have your professional income that might be outside of your home. Um, And as you were talking, I'm so curious about who all you'll end up interviewing and sort of the folks that you'll find. But I was thinking it might be really interesting, and I'm sure you've probably thought of this, or maybe you've even found a few of these folks, but to find some public housing folks in Lowell and Cambridge that don't have family childcare operating in them right now, and that might elevate some different barriers. I'm sure you'll get some really interesting conversations from the FCCs in like Cambridge. You said that I think there's six that were in public housing right now. So you'll get like some really interesting data from that um, about their experiences being in public housing. And I think you might also get some interesting pieces from folks where there's no family childcare in public housing right now too. So just wanted to elevate that. But I think especially for family childcare, I mean, it's their housing and sort of their business model are so closely linked. So just wanted to
Absolutely.
elevate that question.
Thank you, Marissa. Was there anybody else who wanted to share of how housing
This is
sustainability?
Kim.
Hi.
I just wanted to share at least where I work, even though I don't work directly in this same field, but what I see is it's hard to attract the really talented people to where we are because they can't look at like an hour and a half commute if they've got a little child or they're getting home super late. That's in fact impacting the quality of their relationship with their child. Having to move, that affects young children. We know young children need stability. And so there, I mean, it feels like it's at so many levels. You can't live near the people that you love necessarily because you have to be where you can afford to live, and maybe you can't find a place where you can all be together. So many things. Thank you for asking.
And I can actually give an example because I was preparing for this before we got started. I want to say June, a family that we had for 2 years sent us this long email of like, I'm so sorry, but we have to leave. They tried to raise our rent $300. We have to move immediately. We can't conform to paying, the same amount of rent that we're paying for childcare and things of that sort. And just really the complexity of like, this isn't just one family and this just isn't one person's problem. This is everybody's problem. So if a landlord is increasing somebody's rent $300, I don't know what's happening to the person next door, but I'm sure it's not any different because as a real estate agent, I can say the prices are usually comparable. So we're not lowering rent, we're increasing rent. And I understand, the pros and cons of that. But so my family we had them for 2 years enrolled, and they had to make the decision within 1 month because of this this increase in their rent, and left the program, and they went to Connecticut, and they left the state. They didn't just relocate even within the state, they left the state. And like somebody just mentioned, to be closer to family and friends so they can, but on a happy note, since I am communicating with them, they did go to another family childcare program, and it ended up being one that the parents and the families had been in. So it's not always a negative, but this is things that now disrupt my ability to pay rent myself. That also hinders our ability to pay rent, not rent and payroll and taxes and things that as a small business, I am responsible for paying. So every time there's even the lightest disruption, it affects our budget completely. So there's no way of really, as a family childcare program, having a budget of 6 to 12 months, because we know, like I know for a fact, and I can say this, every vacation we always have somebody leave, or we have a transition, or we have, something happen. So it's not sustainable. And that's why I want to have these conversations of like, well, do we need housing vouchers for family childcare providers? Do we need more resources? Do we need to allocate properties and 3 family homes or 6 family homes to really have all of these programs? And how can we really create, again, is not just right now, it's long-term sustainability within our field. And I think as advocates that we all are, as you guys are all shaking your heads at me, which I love for us, that we're all on track of that. It's not the work that we're doing for ourselves or the work that we get to see. It's the work that we know that we're a part of for the long term. We know that there have been people, and I don't want to age anybody, that have been advocating for 20, 30, 40 years for sustainability within this sector. So
I'm
yeah.
one of those 30 years.
I know. I don't want to age you, Amy.
Jessica, it's 10 o'clock. I just
Yes.
want to thank you so much. And 9:30
Thank you so
callers,
much.
please continue to show love and appreciation in the chat for Jessica. I think
Yes.
this is an incredible conversation. We will save the chat, Jessica. We will send it to you.
Yes,
I put your
please.
email in chat. I also just want to acknowledge so many more people getting their PhD in this space is also worthy of celebration. It's just incredible to see people kind of taking the challenge. PhDs are not easy, so I also want to acknowledge that and love. And I know Kim Lucas is on the call, Kate Warren Barnes is on the call. People who have done dissertations are in the middle of it, and I'm sure they are also sending you good vibes. So please,
Absolutely.
Jessica, and thanks to Brian Gold for having this idea to have you on the call. As Donna said, this is the value and the beauty of the 930 call community, that we're seeing these real-time connections. So please come back anytime, Jessica. I
can't wait to come back. I feel like people want to talk to us. I don't know.
Well, I appreciate you wanting to have a conversation and the 930
Of
call,
course.
as they always do.
Thank you,
So
friend.
I will send you the chat. Everybody has Jessica's email. If you didn't catch it, please just email me and I can make a connection. But thank you so much for being with us this morning, Jessica. We are wishing you all the best. I can't wait to hear updates of your work.
Thank you, friends. Have a great week ahead.
All right, thanks, Jess.